Hello and welcome. This is Live with Vickie and Senior Solutions. We're live every single Tuesday at 1 o'clock Central Time. And you can catch us on YouTube, you can catch us on Facebook. And if you have any questions, if you catch us live, that's great. If you don't and you want to watch the replays, that's great. And if you have any questions, feel free to let us know. And Vickie will address them on the next show, which is every single Tuesday.
At 1 o'clock.
Hey, Vickie, how's it going?
Hey, Marion, how are you?
I'm good.
Good.
I'm good.
doing
I'm glad
pretty
to be
good.
here.
Doing pretty good. And another reason to stay in all the rain.
We've been having a lot of rain here
A
in
lot
the
of
Houston
rain,
area.
a lot of rain. So, but glad to be here. Happy to be here and to discuss one of my favorite topics. It's Medicare. We're going to do a deep dive into Medicare, as deep as we can go on in 30 minutes. But we're going to talk about Medicare, a review of all the different moving parts Medicare has, and hopefully people will learn something from that, from this presentation. Otherwise, you can always email me or call me, text me, or whatever, and I can answer your questions. So we're going to get going. My partner, LaQuintin, was supposed to join us today. However, he had an emergency that with his daughter, and so he will not be able to join us today. But we will continue on, and we send prayers to LaQuintin and his daughter, and hope things will get better for him. Okay, but we're gonna get going because we don't have 30 minutes, and it's a lot to go. In Medicare, is a lot of things to talk about, and we may or may not get through all. I'm gonna try my best to get.
One of the things that I want to make sure everybody understands is if there's something you don't understand that Vickie talks about today, or if you feel you have a different circumstance than a typical person on Medicare, she is more than willing to talk to you about that. She's not pushy. She'll just give you the facts, and she'll ask you questions about your situation, because let's face it, we're all a little bit different.
Yes,
Depending on
yes.
where we live and how old we are and what kind of medications we're on. And so Vickie can go over any questions you have. Just write them down.
Yes, yes, and like Marion said, everybody's different, so it's going to be how you use your benefits are going to be different based on you individually. And one of the things that I do when I sit down with beneficiaries is that we review what your situations are, and we pick the best benefit option for you, because everybody is different. Not everybody is not a cookie cutter type of thing, so everybody's different. So we want to make sure you get the right benefit option and plan for you with your circumstances. Okay, so let's get going.
Okay.
Basically, most people get on Medicare when they retire. We talked about this eligibility. You have to be 65 or older. If you are not 65 or older, you must have been on disability for 2 years, or you are on ESDR, and you're under 65, or you have what is it? There's another option. Oh, ALS. So if you have ALS and or ESDR, and you're not 65, you're also eligible for Medicare. Okay, those are the requirements to get on Medicare. You do not, if you're still working and you turn 65, you do not have to basically start your Part B, which we'll talk about in a minute. But you can continue work using your company's insurance plan, and then once you decide to retire, then you basically move to Medicare. Okay. So let's first slide, Marion, and we'll get going on this.
Okay.
This is just a review. So I just talked about that. Basically, your eligibility, turning 65 on disability for 24 months, medical conditions, if you have ALS, ESDR, and you're under 65, you're eligible for Medicare as well. There are 2 different options you can take when receiving Medicare. One is original Medicare's Part A and Part B and the red, white, and blue card, and that's it. And then Medicare, or option two is Medicare Advantage, which is Part C. Next slide.
Okay, we can do that.
Okay, so this is how Medicare is structured. Medicare has four parts: Parts A, B, C, and D. Okay, and I just talked about the different options you can take with Medicare. You can go original Medicare with Part A and Part B, the red, white, and blue card. You would have to add Part D, which is prescription medication. We'll talk about that a little later. And you can also add a Medicare supplement to complement, so to speak, original Medicare option one to take care of expenses that Medicare does not take. Medicare is a 80-20 type of plan, like insurance plan. So Medicare covers 80%, and you would have to handle the other 20%. And that's why Medicare supplements, many people will get a Medicare supplement to handle the 20% that Medicare doesn't take care of. And that's mostly with Part B, different benefits with Part B. Part A is your hospitalization. That basically, Part A of Medicare is hospitalization. So any thing that has to do with you entering the hospital or being admitted to the hospital is covered in Part A. Going to a skilled nursing facility after you leave the hospital, if your doctor feels that's necessary, that's under Part A. Hospice is covered under Part A. ER is covered under Part A.
So, Vickie, let me ask you a question here. You have here under option one, original Medicare. Now, it's kind of hard to see what is under those floor slides under there. But does that Part A, it's included in the original Medicare?
That's original Medicare is Part A and Part B. Okay.
Okay.
Okay. Original Medicare is Part A and Part B.
Okay.
And I'm going through each piece right now under option one. So.
Oh, good. Okay.
So Part A is the first one. That's, if you can't see that on the slide, it's the first little box on the, I guess, on the left, that's closest to the Medicare options.
Some people are watching on their phone or their iPad, so it's maybe a little smaller. It's just a slightly unreadable as far as depending on how small it is. So that's why I wanted to make sure. So option one is what you're talking about now, includes Part A and Part B.
Correct. So option one is original Medicare with Part A, which is all your hospitalization type of benefits, going into the hospital, leaving the hospital to go to a skilled nursing facility if you need rehab, hospice, as well as, excuse me, ER. So that's Part A. Under Part A, as far as the cost of Part A, if you did not have anything else but Part A, except for original Medicare's Part A and Part B, if you went into the hospital, there's a deductible of $1,340. It's $1,340. That covers the first 30 days of hospital care within the hospital. Medicare, even though Medicare is actually very reasonable, you still have some costs that are there with Medicare, because Medicare is insurance. It's just the government's insurance for seniors.
Gotcha. Okay. That makes it very clear. Thank you.
So there are other costs with Part A as far as hospitalization, but we won't go into all the different costs going on. I could go on and on with that. But Part A is your hospitalization, and the biggest thing is to know with Part A, there is a deductible of $1,340 for the first 30 days.
What if you're only in there for 2 days? You still have to pay the $1,340?
If you have been admitted, not for observation, but if you have been admitted into the hospital, you have a deductible of $1,340.
Okay.
Okay. Like I said, that's without anything else but original Medicare.
Got it.
Parts A and B. Now, Part B is your, I guess, doctor medical necessary services. Okay. That is basically going to see the doctor, getting your labs done, any type of preventive care, um, ambulance services, DME, uh,
What's
mental health.
DME?
Oh, okay, sorry. DME is your durable medical equipment, such as oxygen, crutches, wheelchairs, and things like that. That's all
Okay.
covered under Part B, and that's the second little box on the diagram. That's all
Okay.
covered under Part B.
Okay.
So that's there's a limited outpatient medication that's covered under Part B, but very limited. That's usually something that you get in the doctor's office, shot or something like that. That's covered under Part B. So anything that is medically necessary, um, type of services, is covered under Part B.
And what
Okay.
about the deductible? Is that
There is no deductible with Part B as far as Medicare is concerned, but it's an 80/20 plan. So your Part B benefits, you have to cover 20% of that. So if you were to go to a doctor's office, I'll just use a simple example. The doctor's office, his office visit is $100. The Medicare would take care of $80 of that, and you would have to handle the $20 of that. So
okay?
that's how that works. Okay. It's not, like I said, you do have some costs. There is no deductible for Part B, but there is a premium for Part B that
Okay.
they do deduct from your Social Security. There's a premium on Part B, and for 2020, the premium was increased to $144.50. So just rounded up to 145. But that's
And
the
how often do you have to pay the premium?
the premium is once a month, just like you have insurance. You have regular insurance. You pay a premium once a month, or some people, pay it up front, all of it or whatever. But the premium is 144.50 once a month. Okay, so that's one cost of Part B. Like I said, it's also an 80/20 plan. This is where your 20% comes in.
So you pay your premium and you pay 20%.
And you pay 20%. Oh, there is a deductible with Part B. I beg your pardon. There is a deductible with Part B, but it's once a year. You pay $185 at the beginning of the year. The first time you go to see a provider, go in a hospital, see a doctor or whatever, that's when they will collect your $185 deductible, and that's once a year. The beginning of the year, your first I guess appointment with whatever medical benefit you're going to receive. Now, some people will have it split up. If you can't do the 185 all the way through, they'll pay a portion of it, but it's still a 185 deductible that you would have to pay for Part B, and it's collected in the beginning of the year.
Okay.
So for Part B, you have a deductible, you have a premium, and it's an 80/20 plan. So it kind of sounds like regular insurance, right?
Right.
So Part B is what most people look at as medical, and that's the insurance. So your deductible, premium, and then 80/20 plan. So you pay 20% of the cost of whatever your procedure or benefit is. Okay.
Okay.
So that's the second little box under original Medicare.
Okay.
So next one is Part D, which is your prescription piece. Now, I'm not going to go into real detail with Part D right now. We'll talk about that a little later on. Hopefully, we'll get to that. But Part D is your prescription piece. It is an option. It's not a requirement. And Part B actually is optional too. If you are a veteran or like a TRS, you're retiree from the school system, or a veteran or any other company that actually has a retirement plan, and you feel as though you prefer to use your company's retirement plan, you don't have to get Part B either. It's optional, but I don't recommend it unless you're going to stay with your company's benefit plan, for the rest of your life. Okay, it's good to have Part B and Medicare as a backup, so to speak. So you can have a lot of people use it as a secondary insurance if they have a retirement plan with their company that they stay on. So both Part B and D are optional. They're not forced on you, but there are penalties if you do not basically sign up for Part B or Part D when it's your time to do so. Okay?
What?
Yes,
Penalties?
yes, there
What are
are.
you talking about, penalties?
So they basically say if you want this, you get it when you're eligible for it. At the time you turn 65, or after the uh, 24 months of being on disability, you get it. Or you're going to pay a penalty for it. Now the penalty is not significant in the beginning, but over time, if you haven't signed up for either Part B or Part D, it can be significant. For Part B, it is 10 cents a month for every month that you did not enroll in Part B from the time that you were eligible. And for Part D, it is a penny times the number of months you did not enroll in when you were eligible, time the national Part D premium average. Okay, so there are penalties. It's up to you whether or not you want to basically go ahead and get Part B or Part D. Now, a lot of people who turn 65 are healthy, not taking any medication, things like that, and they choose not to get Part D. But as you get older, you may, your health may, have some glitches, so to speak, and you need
That's
medication.
a good way to put it. I
you know,
got a glitch in my get along.
yes,
Yeah.
exactly. So your Part D prescription piece, like I said, it's optional. However, you can get a low premium Part D and make sure, and it gives you kind of like you're not going to get penalized down the line. I do have examples of people who have waited and they got their Part D when they were like 80, and when they got that bill, they went, "What?"
Yeah.
Because it
Yeah,
adds
because
up.
nobody told them. They didn't
Yeah,
know Vickie Owens.
yeah, they did that. That's exactly right. They were not informed that if they didn't get it at the time, that they would be penalized. And same thing with Part B. If you're not informed about all this, the rules and regulations of Medicare, then you can, it's basically you're penalized by being ignorant about the situation, and it's really people need to really educate themselves on this. Like I said, we're going to try to get all this done, but I'm not sure if I'm going to get through all of it because it's so much into Medicare. But so we're going to move on from Part D. Just letting you know there, it is an option. Their Part D is provided by private insurance companies, and each insurance companies has their own set of formulary, but they have to follow the government standard. And any Part D plan, if you do decide not to get it and get another one outside of the Part D with Medicare, it has to be equal or better than the Part D standard that Medicare has out there. Okay.
Okay.
Now, next box is the supplement, which is another option, but it's truly an option. You're not going to be penalized on it. Okay. So it is an option to help you take care of the costs of the things that Medicare does not cover.
What does it say inside that box?
It says Medicare supplement and optional.
Got it.
Okay. So Medicare supplements are sometimes referred to as Medigap plans. Medicare or Medigap plans are supplemental insurance that covers the parts original Medicare does not cover. The 20% with Part B, is not, that you'd have to cover. The Medicare supplement can, if you have a Medicare supplement, rather, you can basically use that to take care of your 20% in the Part B box. With Part A, the Medicare supplement will take care of that deductible, that big deductible to go into the hospital, okay, or any other cost that's associated with Part A and Part B only, not Part D, but Part A and Part B only, that Medicare does not cover, then your Medicare supplement, if you have it, will take care of that, depending on the Medicare supplement you get. Because there are many different types of Medicare supplements. They range from Plan A to Plan O. Okay, so and like I said, when I sit down with an individual, I really go into detail of all this. But we're trying to get it done in a 30-minute period of time, so there's a lot going on there. All right.
Yes.
So if anyone has any questions, they can always text me, and we can set up a time where I can go over these things with you. The other now, so that covers original Medicare, parts A, B, D, and then the supplement piece. Now, you cannot roll over Medicare supplements into Part C. Just a big heads up there, all right? Because when we start talking about Part C is Medicare Advantage plans. It basically covers Parts A and Part B and sometimes D as well. It does have co-pays, deductibles, and co-insurance depending on the type of Medicare Advantage plan that you get. But the whole point of a Medicare Advantage plan is to keep your costs down as far as your health insurance. So there are many types that are out there. There are HMOs, there are PPOs, there PFFSs. There's a lot of different types of Part C Medicare Advantage plans out there that will cover your Medicare Parts A and B, and many of them have Part D included in them. Okay. The additional thing about Part C Medicare Advantage plans is that last little box over there on the right hand side. It says extra dental, vision, hearing, gym benefits, etc., etc. Okay. The Medicare Advantage plans are private insurance plans that Medicare and the insurance companies have an agreement that they will cover Medicare beneficiaries through their plan. So if you sign up for a Medicare Advantage plan, that insurance company is now the is controlled, not controlling, but is providing the benefits for you as far as insurance company coverage. So your it with that they add some of the plans will add little benefits like not little benefits, but dental and vision will be included in the Part C plan, the Medicare Advantage plan. Hearing, gym, some of them add acupuncture, and it goes on. Depends on the plan. You have to really sit and look at the plans and set in your mind what's important to you. Is dental important? I want dental in my plan. So you find a plan that has dental in it. That has a big benefit of dental in it. Some people just have to have that gym benefit. Okay, so it basically has a gym benefit where you can go to not any, but a lot of the 24-hour LA Fitness, those type of facilities.
What about the YMCA?
The YMCA is a big one. It's a big one that basically accepts these benefits from the Medicare Advantage plans.
Fantastic.
Now, one of the things with a Medicare Advantage plan, you have to have original Medicare's Part A and Part B. Okay, you cannot sign up for a Medicare Advantage plan, the option 2, unless you have original Part A and Part B. Okay, that is the one disclaimer that you have to have Parts A and Part B, because what? It's providing you Parts A and Part B. So you're getting the same thing you would get with original Medicare. It's just you're getting it in a different manner. You're getting it through a private company, a private insurance company. I always call Medicare Advantage Part C, and it's just me, privatized Medicare. Okay, so it's privatized Medicare. And then, like I said, you get the extra benefits, and many plans have a lot more than what I've just listed there as far as extra benefits. But you just have to look. It depends on the plans. Now, Part D included in a lot of the plans, especially the HMO type plans. However, if you are a military, just using the military as an example, I'm a vet, so I know all about this. But as a veteran, if you're using the VA for your prescription drug piece, you don't have to get a Medicare Advantage plan with Part D if you choose not to. So there are certain plans, and then there are other scenarios where you wouldn't get the Part D. If it's equal or better than Medicare's Part D standard, then you can use that prescription drug plan instead of the Part D.
Oh.
So there are Medicare Advantage plans that don't include the Part D because they're giving the beneficiary the option of not getting it because they're getting it from another source. So that means that plan doesn't have the Part D, but a lot of them, because it doesn't have the Part D, they'll kind of build in other options and benefits and enhance the plans that don't have the Part D included in it. Okay.
Okay.
All right. Let's go on to the next slide.
Okay.
Okay.
Just in case people have forgotten what we look like, and because we're doing the slides, yeah. Hey.
Hello. I'm still here. Still here. Okay. So I just kind of talked about all this. This is just in text. I'm talking about the five parts and plus supplements, original A and B. So we just talked about all that. So we, like I said, Medicare supplements is optional. So we can go to the next slide. Okay, and I talked about this too, but here's a little bit more detail on it. Must have A and B, like I said, covers all Part A and B services. Here are the different types of Medicare plans. You have HMO, or Medicare Advantage plans, let's say. You have HMOs, you have a HMO POS, which is point of service. That's a little different. It gives you a little bit more because HMO, majority of people know HMO has some limitations in that you have to stay in network and you have to see providers within that network. And that's to assist in your care. If you have one doctor and that basically a primary physician that's caring for you, they basically do coordination with all your other doctors. So you have to get referrals and you have, basically you have to stay in network. Those are the two biggest things with an HMO. With an HMO POS, it gives you the option of possibly going out of the network to see a doctor out of the network, but it's going to be at a higher cost. But you do get the option to go out of network with an HMO POS. All right.
Okay.
So that's an HMO as a whole. It's a private company. It's a networked insurance plan. You have to stay in network to receive the benefits that you're getting through the HMO plan. You have to get a referral from your primary care physician. You have to have a primary care physician, and you have to get a referral from that primary care physician to go to a specialist, such as a cardiologist or whatever. And excuse me, but with an HMO POS, you still get neither referral, but you can kind of go out. You can go out of network, but it's going to cost you more. Okay, a PFFS. Woo, tongue twister. PFFS is another Medicare Advantage plan that gives you the option to be able to go out of network, see any doctor you want to see, as long as that doctor or that provider accepts the plan. So it's not network based, but it gives you the freedom to go see a doctor in a way like Medicare is. Original Medicare does not have networks. You can go see any doctor that accepts Medicare, where PFFS is not designed in the same manner. If the doctor or the provider will accept the plan and the plan's provisions, then you can go see that doctor. If they do not,
Okay.
you cannot go see that doctor or go
All
see
right.
the facility. Okay.
Okay.
PPO, I think most people know it is network, but you're also able to go outside of the network, but it's going to cost you more. Okay, and it's best to just see a doctor within the network. But it gives you a little bit more flexibility there. Many of the plans, like I said, have Part D. Now, let's slip to the next slide because we're running out of time.
Okay.
Part D. Okay, this is the Medicare's standardized Part D plan. So when I say standardized, this is how they basically put Part D together. It has 4 stages. There's first stage is the deductible stage. That means that in every year, the Medicare basically changes the deductible, unfortunately. And so you have to meet your deductible before you can move into the initial coverage stage, where now you're paying flat copays through a tier structure. Medicare's Part D has 5 tiers. Now, that the deductible actually is not really for generics. So if you are taking generic medication, you don't have to meet the deductible. But as soon as you have a prescription that is considered a tier 3 and above, or brand name or specialty medication and above, then you would have to meet whatever the deductible is for that year. Okay.
Okay.
So during initial coverage stage, you are only paying flat copays, and excuse me, there is a what they call a threshold amount. So when you hit the cost of your medication hits the threshold amount, then you're moved to what is called stage 3, the coverage gap, or a lot of people know it's called the donut hole. I know we're running out of time, so I'm not going to get a chance to really go into specifics on this. However, in the donut hole, you're now paying a percentage of your cost of your medication, not a flat copay. So because of that, you're paying a percentage. Your medication cost tends to go up higher. Again, there's a threshold. The total top cost of your medication when you reach that total cost in stage 3, the coverage gap, then you move over to catastrophic stage, and that's when your medication goes back to a flat copay stage that's very low. Okay. Now, I know I rushed through Part D real quick because there's a lot more detail in it that I couldn't,
maybe we could cover that next week.
We could, if people want to see it next week, we can. One of the things I want to say before I know, like I said, we're running out of time here, is to those people, other words, if you're here in the show and you're listening, you're like, please click on follow. I think it is follow our
if you're on YouTube, you'll subscribe and you'll hit there's a little bell, and if you click on the bell, you'll get notified that we are live. And if you're on Facebook, it's a like.
Oh, like. Okay. Yeah. Okay. Like. Cool. I just thought about it. So we'll make sure that everyone that's online.
Yes. And also you can subscribe to the podcast. Yes. So if you're on iTunes or some other platform where you like to receive your podcast, you can subscribe to the channel. Okay.
Well, that's really all. I mean, that was a rushed version of of Medicare as a whole, covering the parts.
You did a really good job of explaining it, because it is very complicated, and I know that everybody's a little different. And that's one of the things I'd like to go over sometime, some of the things that aren't talked about, not the norm. Like I know people who are on Medicare that are traveling around in a motorhome. Mm-hmm. So how are they covered? And there's other things. So people that are still working, Yes. So maybe we could do that one week where we just talk about the unusual stuff.
Yes, we can. I wanted to do this do this particular segment because the Part C Medicare Advantage in open enrollment is starting in October and really starts the 1st of October for people to review their plan. So I want people to start thinking about, how is my plan doing? If you're on a Medicare Advantage plan, if you're not on a Medicare Advantage plan, know that this is the time if you wanted to switch from original Medicare to Medicare Advantage plan, that is the time to do so. And the other thing is I want to mention is I will be in Walmart store during AEP, and that I can also answer people's questions there. Okay, I'll be there. I don't know my hours yet, but I will be consulting with the pharmacy in the Walmart store, and that to help them and people who have questions about their plans.
Oh, that's very nice.
Yeah, so I'll be plugging me being in the Walmart stores, going forward now, because I don't only do Medicare. We're going to talk about other things as well in this live show. So I do everything that has to do with insurance, but because we're coming into a significant part of a lot of people's lives with the health insurance, I wanted to basically kind of give an overview of that and people who are about to turn 65 or becoming eligible.
Perfect. Thank you so much, Vickie. And thank you, audience, for being here. Thank you for hanging out with us and letting us explain the Medicare. I said us. Can you believe that? I don't really explain it, do I? But you know what? I'm learning. And
you're it's us. The two of us are in this together.
Yes, we are in this together. We appreciate you. Remember, Vickie is very happy to talk to you. Call her. I'm going to give you her mobile number first. It's 713-444-3269. She'll accept texts or phone calls. And you can also call her on her business line, 281-849-8255. 8373. She'd be happy to answer your questions or schedule an appointment where she can talk to you on Zoom or on the phone. Thank you, and we'll see you again next week.
Bye-bye.
Bye for now.